So guys, we are just going to do a reading of this pelvic MRI. All right. So let's have a look at this T2 sagittal image. We can see a well-distended urinary bladder, which is showing T2 hyperintense signals within it. And you can see the wall of the urinary bladder shows a dark T2 signal. And posterior to the urinary bladder, we have the uterus, which is anteverted. Okay. So in the anteverted uterus, you can see there is an asymmetry in the thickness of the walls. The anterior wall is thicker than the posterior wall, and you can see there is a T2 hypointense.
Daddy, what is that?
Yeah, this is a fibroid. You know what this is?
No.
It is a fibroid.
No.
It's a benign tumor.
No.
So, as you can see, it is close towards the submucosa, and much of it is intramural, all right? And we have a nice, smooth T2 hyperintense signal coming from the endometrial cavity. If you can identify the junctional zone, that appears as a T2 dark signal, which is fairly well defined, except at the portion where the fibroid is abutting the mucosa. All right, and then here further down at the uterocervical junction or the lower uterine segment, you can see the scar of the previous lower segment cesarean section. All right, and then here you can see the nice and homogeneous T2 hypointense signal lining the cervical canal. So any disruption in this T2 hypointense signal would suggest malignancy. So this is just some learning points on how we read a pelvic sagittal T2 MRI.